And you know all the hair on my back? I was thinking about shaving the Fox 29 logo into that hair. But instead, I'm going to use this new hair removal technique that Jen told me about. It's big and Philly. For the guys, not just for women, but for guys.
I want to know now. Can you give us a hint?
Here, do you want to see?
No, I'm scared because I left my electric razor on my desk
I've got some hot wax waiting for you.
Get some hot wax. So all that as I join you up there in the studio about 6:55.
Okay.
All right.
The mics are working here.
So we'll get back for laser hair removal. I wonder if a guy can do that on his face.
It's laser.
What'd I say?
You never told us.
It's that was the tease. It's laser hair removal.
Okay.
And men and women are getting it now. Here's Sue.
Every place?
Well, he showed this guy with the back. That
No,
like...
just in Ardmore.
Oh, okay, thank you. I'm clearing that up. All right, let's talk about somebody who's too young to have to worry about that yet. Our little bus stop buddy, after we look at Old City and see that the sun is shining.
All right, got to take a break. It's 8:11. So much more show, including hair removal.
Yay.
Right, Chanel? Bruce, you want a part of that?
No, I don't, actually. I'd rather get kicked in the stomach.
Well, we can provide that, too.
My hair is falling out naturally, thank you. I don't need removal for the laser.
Anyway.
Here's one positive human being, I'll tell you that.
She's going to live forever. Jen Frederick.
Yeah, she's 93 years old. Look at her. Looks great.
There's nothing toxic here. Okay, this is what we're going to do, okay? We're going to laser off some hair. This is Braden Colburn's wife. Nadine, you know her. Big-time Flyers wife. Hi, baby. She's going to tell us whether it hurts or not. Lasering off hair, live on TV. Look at those legs. Yep, she used to be an answer.
Well, an interesting story this morning from Jen Frederick. She's talking about laser hair removal. Have you ever seen it done?
Oh, yes.
I don't know if I have, but the doctors say it's not painful. We wanted to see for ourselves if it's painful. I've never seen it done.
Well, I've seen this done, and I felt it. It feels like a rubber band snapping on your skin, Jen.
Well, I have to say this. You know Dr. B, Dr. Eric Bernstein. Good morning.
Good morning.
Okay, we have visited with him, and the last time I was here, you said, hey, you should get some laser hair removal, blah, blah, blah. And I ran like a little girl, right?
Well, you ran.
I ran. And I said, not for me. But you said everyone's doing it, and it's not very painful. So we have Nadine Coburn here. Good morning to you.
Good morning.
Okay, and you have agreed to let him do this live on your legs so we can all feel the pain or realize that it's not painful at all.
Yes, it's not that bad.
You've had your armpits done.
Yes, my underarm's done. And it's like, just like that.
Okay, cool. And does Braden know that you're here?
Yes, currently he's in bed sleeping with our dogs.
And of course, he's a big-time Flyers guy, in case you have been living under a rock. Okay, so tell us, first of all, why she's a good candidate.
Well, we want the hair to be dark,
Okay.
and the skin should be lighter. That's the ideal candidate.
Okay.
So she's ideal, and she handles it really well.
And what's really cool, we talked about this, is that, you know, when you want to get your legs waxed or your underarms waxed, whatever, you have to let it grow out and be all hairy, but you want them to come in freshly shaven.
Right, exactly, because a laser reaches in the skin and treats the hair underneath.
Okay.
And the nice thing is it actually not only takes away the hair, but it makes the skin really smooth because it shrinks the size of the follicle.
Oh, so you need less fancy lotion when you're done?
No, we always like the lotion.
Okay, I know that.
Like
All right, so show us what you're going to do here.
So what we're going to do, we draw with white, because, you know, white reflects light away, right?
Right.
You don't want to draw with black ink. That would be bad. And that's so we can know where we've been, and we just kind of treat square at a time. Lisa, who's hiding in the corner, is really the one that does the laser. But she does 99% of the hair removal in my office.
Okay.
She's an RN, and she's totally awesome.
And what kind of laser is this that you're using?
This is a YAG laser, and this is for darker skin types. It really matters a lot when you're treating skin of color to use a darker, a laser that's good for darker skin types.
Okay.
And that laser is the neodymium YAG. Neodymium
Okay.
YAG. So now.
And you haven't put anything on her legs? No numbing? No.
Well, you know, the thing is about the legs, it's a big surface area, unless you're short.
Right.
You know what I'm saying? But you can absorb the medicine into your body, so I generally don't use numbing on the legs.
Okay, fire away.
I'm going to fire away. You ready?
Yeah.
1, 2, 3. And that's the laser. And to be honest, what we're seeing is an aiming beam that's green, and then we're seeing sort of reflection from the skin, because this laser's invisible, which does not mean you can take your glasses off. And it actually goes pretty fast when we really see.
And so
how you doing up there?
How you doing?
Fine. It doesn't.
You're not even flinching.
But I will say, if the men, we have more pain receptors. We're not as I
Men
think
cry more than women?
I think yes, but I think it's because we feel it more, not because we're not tough.
Okay, well then, you know what we
We're
should
tough.
do in the 9 o'clock hour?
Oh no.
Let's get a man in here.
Okay.
Okay, we're going to get a hairy beast of a man.
Men are not as tough, I will say.
Okay, so we'll hope that he'll cry.
may.
And of course, we're going to do his back. And again, you're not feeling anything.
No.
Well, you know what it is though? The darker the hair, the more you feel, and the thicker the hair. Her hair's not that thick.
Okay.
So she's not feeling this.
People, you've seen it on TV. Dr. B, thank you.
My pleasure.
We're coming back in the 9 o'clock hour with a hairy ape of a man. Right? Is that
Well,
what
We have
you're
a hairy
saying?
ape?
I would not say that. No, I would not.
No.
He's just the right amount of hair.
Okay, he's just the right amount of hair.
He's not an ape. No, no.
Not an ape. We'll see what he is. You'll see, because you're going to stick around till 9. You know, that's not. She didn't flinch at all, and I've seen these people before where they
Yeah.
try to hide the flinch.
Yeah.
She didn't even. There was no hiding of the
She's
flinch.
a highly trained athlete.
Yeah.
She's tough.
It doesn't hurt. I mean, it's worth it.
I mean, you're a hockey player's wife, so you
Yeah,
are tough.
She knows
I am
pain.
tough.
And did you say how long it lasts? You probably said it, Jen.
Basically, they'll do a couple of treatments now, and then by the summer she'll be fine, and that's why you want to start now.
Right, yeah, the reason to start now, people don't think about it until it's like right before the summer. But if you start now, get a few treatments in, no shaving, up, out the door, just
Okay.
enjoy the
And
summer.
it lasts
Yeah, guess so.
for a long time, maybe.
That's for a very long time. People need maintenance treatments.
Long
like
time.
for me on my neck, I got razor bumps. I come about every 2 years. I'm due.
Look at that. I can get
Okay,
rid
we're
of
going to talk a
razor
little bit
bumps.
more. Yes.
Yeah.
We're going to
big.
talk about that in the
like
man
that.
segment.
I got
In the
you.
man segment.
All right.
Thank you, Jen.
I'm looking forward to
Okay.
the man segment.
But it's painful in that, the lower regions. What do you think about that? Brazil. You know what I'm talking about? Everybody hurts sometimes, Hang around here, please. Wouldn't you like to see a laser hair removal on a man who's hairy live on television?
I've heard that he might cry. It's that much hair.
That even makes the segment better. Come back and watch it. Live hair removal on Good Day. There's a tease. If you missed our 8 o'clock hour, shame on you. We took the hair right off of a woman's leg
Yes,
live with
but
a
now
laser.
we're up in the ante. We're doing laser hair removal live on TV. I think we have a man.
Jen, do we have a man?
We have a man. Don't show the man yet.
Okay.
We're
Hey.
going to see the man.
Oh, he's
You're-
naked.
He's naked. I want Dr. B's back. Good morning.
Yes, good morning.
Okay, so here's the thing. I want people to know just what you can do. If there's a guy, let's show the pictures, that's like crazy, hairy back.
Yes.
You can manage that with a laser.
We can manage it, yeah.
Would you take all of that down? Does
would
all
take it
that go
all off.
away?
It all goes, yeah. I mean, you're seeing a picture if they're showing it.
Yeah.
That's after 4 treatments, about 6 months or 8 months after 4 treatments.
And that hurts a heck of a lot less than waxing, shaving, nair, whatever.
Yes, but the first treatment, if you have really, really thick hair, you'll feel it.
Okay.
For the first treatment. After that, not so bad.
And because we're talking about the man segment, Mike Jarrett had said, I wish I could do something about the stubble on my neck.
Yeah.
You too have.
I just shaved with a razor, must have been used by Fred Flintstone or something. It was horrible. And I used to get tremendous bumps. So I now get lasered probably every couple years. In fact, I'm due.
Okay.
It gets rid of the bumps very quickly.
But you can't do like your eyebrows and stuff like that.
Never above the lower rim of your eye because these lasers penetrate deeply.
Okay.
And so you don't want that light around the eye because you could hurt the eye.
Should we show people the naked people?
Well, yeah.
The naked guy? It's Tad. Hi, Tad. He's not naked. He has pants on. So basically what we're going to do is we're going to show how you would laser someone's chest. So put your little mask
Sure.
on. And why are you putting that on?
Well, because the hair can be irritating. You smell it a little bit
Okay.
because we're heating it up.
We're heating it up.
That's what we're doing.
And so he looks, basically you've shaved half of him. The other half is not so shaved. And how long after you do this will he have to come back to get rid of this forever?
We usually bring them back 6 weeks later.
Okay.
And then 6 weeks after that. And then the interval gets very long, 3 to 6 months, 6 to 12 months, longer and longer and longer.
And just so everyone knows, we still have Nadine in here because she did not flinch and she was totally cool. And this guy's never had it, ever. So we're going to see really how much it hurts. And if he cries like a baby, she's going to make fun of him.
You guys are mean to the men.
Well, it's the house of hormones
That's
here, baby.
cold. He didn't get to go in when she was getting, although she was tough.
Okay,
We
so here
have
we go.
more pain endings.
All
Ask
right.
any doctor. Ready?
Yeah, I'm ready.
1, 2, 3. Is he ready?
Oh,
You
he
all
didn't flinch.
No, he felt it. He moved.
Did you feel it?
No, not at all.
Come on, a little
Come
bit.
on. See, now that you called him out, he's not going to act like it hurts.
Now, I will.
It doesn't hurt.
Okay, have you ever shaved your chest?
I have.
Does this hurt more or less?
That's a silly question.
Be honest.
I don't think it's comparable.
Have you waxed your chest?
No, never waxed.
That
What
would
about
hurt.
Nair?
Never. Just shaved.
Do you have a girlfriend?
I don't.
Do you want one?
I'm not sure.
So, Nadine, do you think he's faking it? Thumbs up or thumbs down? You think he's okay?
I think it's okay.
She thinks he's okay.
I'm fine.
All right, so,
Surprised it doesn't hurt more.
okay, all right.
There you go. You want it to hurt, though?
No, we don't want it to hurt.
Okay,
He's
yes, you
looking
do.
good. And
You
what's
do.
that right there?
That's suction for the...
Because the hair is flying around a little
Well,
bit.
it's like the smoke from the hair.
The smoke from the hair.
There can be. I mean, does this hurt at all?
Nope.
Why would that hurt more?
Well, it's a little bit thicker there.
Oh,
thicker the
goodness.
hair, the more light it absorbs.
Okay.
The more light it absorbs, the more you feel. You know, that's kind of how it works.
All right. And the thing, you also said that you typically don't miss a spot. You know, Chanel and Mike, when you're shaving, sometimes you miss a spot.
Oh, yeah.
Doc-
Yeah.
You can. After the second treatment, though, you don't worry about that.
Okay.
But sometimes after one treatment, you can see missed areas.
And
Just
just
doesn't miss a spot.
just
I
so
do.
everyone knows, Dr. B's been chasing me around this office
Yes.
with this thing, but I'm still too chicken.
You're such a chick. Why?
Take one to the hand.
You watched it today.
No, I'm not taking one to the
You're not?
hand.
Your face.
No. No. You can't do it on the face, you big dummy.
Well, do your underarm.
He wants to do my pits.
Your armpits? That would hurt.
All the celebrities do it. You know they do.
No, it's not going to
I'll let
happen.
him spray tan me. You have spray tan here?
We don't. But I believe in spray tan.
Do you have lip gloss here?
Lisa might. I believe in spray tan.
I know
but
you
you're
do.
a chicken. We're going to
Yeah.
treat
Okay,
Bikini
someday
season.
we'll do something.
Today.
Be quiet, Mike Jarrett.
All right, sorry.
And listen, thank you for doing
Yeah.
this.
Sure.
Okay, so for sure it
like
didn't
a
hurt.
champ.
Did not
Tad.
hurt.
All right.
Not
Okay.
one bit.
And by the way, they couldn't find a guy to go on TV and do this. It was hard for them to find someone. It's kind of
Yeah.
embarrassing.
Thank you, Tad.
But
No, he's not that hairy.
you did really well.
Thanks.
Are you
Thank you,
jittery?
Tad.
It's Tad.
You can lift up your glasses.
Tad. Hurts a
I can
tad.
see him, and he can see us.
Hi, Tad.
Hi, Tad.
Okay. All right. Hi, Tad.
Nice guy.
Isn't he cute?
Nice of
Good
him.
sport. That should be the promo. When was the last time you saw a doctor vacuuming a man's
The
nipple?
offers are pouring in, dude.
Yeah.
Never.
Next good day.
If you missed it,
We
here's
bring
what
you
you
good
missed.
TV.
Yeah.
Yeah.
That didn't hurt at all. It really did. Yep.
Yeah, it's hurting.
I mean,
It's
it's,
like,
Yeah.
oh,
you know,
it's
the hair's
Okay.
hurting.
not that thick.